Hi, I'm Nick, paramedic and search technician for Norfolk Lowland Rescue. Today is World Restart a Heart Day, and seems it is. I thought we'd run through a CPR type scenario and give you guys a bit of an instructional video. So, we come across a patient. The first thing we're going to do is check for danger. We're quite safe here. It's my house, so it's pretty safe normally. We're then going to see if this person is responding to us. So we're going to come down. Hello, can you hear me? You might want to do that both sides in case they're deaf or something like that. Give them a bit of a shake and a squeeze. This person's not responding. We're going to have a look at their airway. Make sure it's not included. So we'll have a look at there. Little look inside the mouth, make sure there's nothing obvious. We can then look at head tilt, chin lift. We can open that airway up, make sure they're getting good air entry down there. And then look and listen. You can have a feel as well if you're trained to. Up to 10 seconds and see if there's any work of breathing, any signs of life. At this point we confirm that there is no signs of life, there's no breathing, so it's a cardiac arrest and we need to do something about it. This is the big difference between the UK and other countries, where people don't know bystander CPR, and the survival rates over here are around 6% in comparison to some countries which have got 60-70% survival rates in younger cardiac arrests. So, to perform CPR, you take the heel of your hand, place it in the centre of your chest, roughly in line with sort of the adult male nipples. You're then going to interlock your other hand on top and push down with your arms straight, roughly 120 beats a minute. So, you can do 30 of those and then 2 breaths. If you don't feel like doing the breaths for whatever reason, the compressions are far more important, so continue your compressions continuously. If you were going to do the breaths, it's head tilt, chin lift. Make sure their nostrils aren't included, and 2 breaths in, so. And back on the chest for 30 compressions again. In the meantime, hopefully someone's going to get you an AED or a defibrillator. These things make a big difference and they're often appearing in villages and communities now, as well as large shopping centres, train stations and other areas. The hardest bit about the defibrillators is turning them on. Access codes will be given to you by the ambulance service when you phone to get them from locker, as well as locations. Once you've pressed the green power button on the defibrillator, it will tell you what to do.
Call emergency medical services now. Adult mode. Follow the voice prompt calmly. Remove all clothing from chest and stomach. Rip clothing if necessary.
So your patient needs to have a bare chest. That includes bras on women that need to come off.
Take out the pads from the bottom of the device.
Your pads will normally be in a foil
Tear
packet.
open the pads
Tear them
packaging.
open, remove them. They're labelled 1 and 2.
Look closely at the picture on each pad. Peel off the pad labelled 1 and stick to the bare skin of the patient, exactly as shown in the picture. Peel off the pad labelled 2 and stick to the bare skin of the patient, exactly as shown in the picture. Press the pads firmly to the bare skin of the patient. Look closely at the picture. Do not touch
Once the
the
pads are
patient.
on, it will tell you not to touch the
Analysing
patient.
heart rhythm.
Analyse the rhythm.
Shock advised. Stand clear.
Make sure
Press
no one's
flashing
touching the
orange
patient.
button.
Press the
Shock
orange button.
delivered.
We'll deliver a shock. Continue with CPR.
Begin CPR now. Press the flashing blue I button for CPR voice prompt. Reanalyzing heart rhythm
Now,
in 2 minutes.
I was here by myself, so I had to stop to put those pads on. In reality, if there's 2 of you, one of you can be putting the pads on, the other one can be continuing chest compressions while that's going on. The only time you come off the chest is when the machine tells you to stop compressions and do not touch the patient, so it can analyse the rhythm. In 2 minutes' time, it will do the same thing again, and you repeat this cycle until emergency services arrive and take over from you, or the patient starts to speak, breathe, or gets you off them. Don't be scared of AEDs. there is nothing you can do wrong with them apart from shocking someone else touching the patient. They will not shock a patient that does not need it. They're a safe device and it can make a big difference in cardiac arrest. Happy Restart a Heart Day.